Many of us have questioned, why am I feeling dizzy? Whether it was on an ordinary day or when we were ill. While dizziness might be unpleasant, the fact that people frequently experience the condition is probably not shocking to you. However, you might not be aware that vertigo, a similar but more severe illness that makes you feel as though the room is spinning while you're still standing, is also frequent. According to the University of California San Francisco Medical Center, it affects around 40% of persons over the age of 40 at least once in their lives. Vertigo and dizziness might also result from a simple vitamin deficit. Due to its function in maintaining fluid balance and blood pressure, vitamin D deficiency has been linked to vertigo, according to a study. How can you tell if you are experiencing vertigo or just regular dizziness? The key distinction between the two is that while dizziness only temporarily throws you off balance, vertigo can also result in nausea and vomiting and may be a sign of a significant balance disorder. However, the severity of dizzy spells can vary, from mildly unpleasant to severely incapacitating. Life quality can be significantly impacted by vertigo. It is more akin to a delusion that gives you the impression that everything is spinning. Even when you are still, you could feel as though you are moving. When you turn your head, you might experience vertigo. As you mature, these episodes will get worse and last longer. The discomfort could be so severe that it makes it difficult to stand up. Even feeling queasy is a common side effect of vertigo. Let's discuss a few typical causes of vertigo. Meniere's disease. This is a disease that impacts the inner ear. A viral infection, allergies, or an ear injury can cause an accumulation of fluid in the inner ear, which is how you can identify it. It can result in hearing loss, a ringing noise in the ears, and the sensation that your ears are plugged. Meniere's disease-related vertigo can linger for months. Labyrinthitis. Another name for this illness is vestibular neuritis. The two vestibular nerves in the inner ear canal swell and itch. Viral infection or an inner ear infection are two possible causes of labyrinthitis. Vertigo may be accompanied by hearing loss in such circumstances. The risk of this illness is greater in older persons. Dehydration. Water makes up about 60% of a person's body weight. In the human body, water serves a variety of purposes. The movement of blood and nutrients throughout the body is one of water's most crucial roles. As a result, even minor dehydration can cause a person to feel lightheaded and queasy. Drinking a lot of liquids can help with this kind of vertigo. Benign paroxysmal positional vertigo, BPPV. This is one of the most typical causes of vertigo. Small crystals that break loose and float in the inner ear canals are the source of this illness. Semicircular canals are the name given to these passageways. BPV-related vertigo typically subsides on its own after a few minutes of existence. In these circumstances, jerky motions or specific head movements can cause vertigo. Although the precise etiology of this illness is unclear, significant head trauma has frequently been linked to it. Vertigo, weariness, and brain fog are all common signs of vitamin D deficiency, according to a study. It is important to monitor your vitamin D levels if you frequently feel lightheaded. Around the world, vitamin D insufficiency is a serious health issue. Several skeletal and non-skeletal disorders' development, progression, or severity have been connected to this deficit. In many clinical diseases, normalizing vitamin D deficiency with vitamin D supplements stops disease progression or leads to clinical improvement. The most frequent cause of positional vertigo is benign paroxysmal positional vertigo, BPPV. One of the potential causes of its development is vitamin D deficiency. To evaluate the connection between vitamin D insufficiency and BPP attacks that recur often, serum 25-EOH. D was measured at the first visit in a case-control study involving 40 individuals who had been clinically diagnosed with posterior canal BPPV. The 20 patients in group A received vitamin D supplementation in addition to the canal repositioning maneuver, while the 20 patients in Group B received only the canal repositioning maneuver as treatment. All patients were monitored for 6 months, during which time the neuro-otological evaluation was redone and recurrence attacks were noted. After 6 months, the serum vitamin D test was performed. In this study, there were 14 men and 26 women. ranging in age from 35 to 61 years. At the initial visit, the average serum level of 25 LHD for Group A was 12.4 ng/mol, and for Group B, it was 12.2 ng/mol. All patients had low serum levels of 25 LHD, below 20 ng/mol. Recurring BPP episodes were noticeably less frequent in Group A than in Group B. Low serum vitamin D levels and BPPV recurrence is related. 2.4% of the general population suffers from benign paroxysmal positional vertigo, BPPV, which is a moderately common condition. Particularly in elderly adults, frequent recurrent vertigo bouts hurt their quality of life and hinder everyday tasks, leading to incapacity. Results of numerous clinical investigations showed that vitamin D administration had a positive impact on lower limb muscle strength, body wobble, and physical performance in participants older than 50 years. A comprehensive evaluation of multiple research found similar findings regarding the positive impact of vitamin D treatment on muscle strength. The therapy for older people with vertigo and imbalance often includes improving postural balance. Restoring serum vitamin D strengthens lower limb muscles, which is thought to improve balance and reduce the risk of falling. The coexistence of BPPV and vitamin D deficiency is anticipated to be widespread because vitamin D deficiency is widespread in the general population. Observations also showed that people with vitamin D deficiency had more severe BPPV. However, there are few studies linking vitamin D insufficiency to vertigo, and this situation hasn't been sufficiently examined. Epley maneuver, also known as the canalith repositioning procedure, is frequently more effective than waiting for benign paroxysmal positional vertigo to go away in treating this condition. Your head can be moved during this process by your physician, an audiologist, or a physical therapist. It usually starts working after 1 or 2 treatments. If you have a neck or back condition, a detached retina, or blood vessel problems, let your doctor know ahead of time. Epley's technique is currently a safe and effective way to treat BPPV, with recurrence rates ranging from 12 to 36% in different trials. It was suggested that increasing serum vitamin D levels to an adequate level could enhance the therapeutic benefits of rehabilitation by strengthening the muscles in the lower limbs and enhancing neuromuscular function. Due to these factors, the current study was done to investigate the association between vitamin D insufficiency and the severity of BPPV, as well as to assess patients' outcomes following vitamin D deficiency treatment. A lack of vitamin D can result in several other health issues in addition to weariness and dizziness. The primary function of vitamin D is to facilitate the body's absorption of calcium, which is essential for healthy bones. Your body will be less able to absorb calcium if you are vitamin D deficient, which can result in brittle bones. Muscle discomfort can also result from a vitamin D deficit because the body won't be able to produce enough energy to maintain muscle function. There is some proof that depression can result from a vitamin D shortage as well. One explanation is that vitamin D is involved in controlling mood. Your mood may be more prone to swings if you don't get enough vitamin D. Inflammation brought on by low vitamin D has been related to a higher risk of infection. Your immune system may be weaker and more prone to infection if you have a vitamin D deficiency. A shortage of vitamin D can make it more difficult for the body to fight off infection because vitamin D is also important for the immune system to function properly. If you experience any of these symptoms, it is imperative to talk to your doctor about them. Vitamin D insufficiency is a condition that may be treated, and there are several solutions available. Increasing your exposure to the sun is the greatest strategy to combat a vitamin D deficiency. This might not be practical though. In the winter, or if you live somewhere with little sunlight, you might need to take a vitamin D supplement in certain circumstances. Both liquid and tablet supplements for vitamin D are available. According to a study that was available on August 5, 2020, in the journal Neurology, taking calcium and vitamin D twice daily may lessen your risk of experiencing vertigo once more. However, your doctor can advise you on the most appropriate course of action for your particular circumstance. To learn more in-depth information on other topics, click the subscribe button now.